Good morning, Mr. Moshe.
Morning.
My name is Nzel again once more. Good to see you, sir.
Good to
How
see
are
you.
you doing this morning?
Great.
So, I would like for us to talk about the healthcare system in the US, specifically in Maryland, since we're in the state of Maryland. What is it all about the healthcare system? Do you think it's working? How are they paying? How are the citizens paying for it? Or the state of Maryland assisting in providing healthcare to these citizens? Thank you.
Thank you, Inzel. It was a wonderful question. That's what we're going to talk about today. Before I start, I wanted to show you we have our air purifier here. It's a great idea for the indoors and in your car. We'll take out the contaminants in the air that we do have due to impure coal and natural gas firing plants. We also have some non-aerosol aromatherapy spray, essential oils. Okay, so the question is, what is going on with Maryland healthcare? Healthcare in the United States and in Maryland is in a crisis. We're considered number 11 in the world, but we're spending much more than other countries. In fact, we're spending 35% more than Canada. Maryland has an innovative, however, all payer hospital rate regulation system, which sets global budgets for hospitals and has lowered overall healthcare expenditures. So we say your hospital, you can only spend $10 million this year. However, overall, 350,000 Marylanders out of 6.18 million do not have insurance, even with Obamacare. Maryland spends $19 billion on healthcare last year, so we're at 19. That's our number one line item, more than all the education, both elementary, secondary, and college, that we spend about 15 billion. Unforeseen medical expenses and bills are the leading cause of personal bankruptcy and financial distress. Many residents avoid necessary medical care due to the fear of surprise, very high medical bills. They don't tell you necessarily what you're going to be charged, and they don't, it depends on your coverage, which we'll get to, is not always full coverage. Now, the situation is this. We spent 19 billion, but as you know, there are other programs involved. In fact, if you look at the whole Maryland spending on healthcare, private and public, it's a shocking $65 billion annually. Nobody tells you this. Medicaid, 14 billion. 10 comes to from the federal government off of our taxes from the country, 4 billion from the state. Medicare, also from the Medicare Trust Fund. We have a fund which is running out already, just like Social Security is running out. We're not going to be able to have the full fund because we're using it. $10 billion a year that covers people, the elderly and the disabled. State funded, $5 billion. Private insurance. The average Marylander spends $5,730 on insurance. That's his cost. The company pays more than that, as much as 3 times, for a total of $35 billion. So the question is, what is, we pride ourselves on this private insurance, but it's basically a scam. It's a trust of doctors. Number one. Number two, the CEOs of the insurance companies. Number three, the healthcare, the Wall Street that owns these insurance and other companies, those who own the stocks and the shares. They are controlling the system. They're telling you how much you're going to pay, and whether you have insurance or not. And then those who are uninsured, essentially, we're paying for them anyway, right? So essentially, my plan is to get Maryland to be the first state to be universal health care coverage. What does that mean? We're going to cover everyone at a total cost of $55 million or less. That's a savings of 15%. That's very reasonable. We can do it. Now, you're going to say, how can we do it if the federal government is controlling Medicare, Medicaid, and some of the programs? Well, they give us the money, so we can just say, we're going to spend it in this way. Let me just, finish this before I talk about the model. Here's what we're going to do. Maryland must provide a single payer universal healthcare system from cradle to grave, including dental, vision, mental health, and holistic health. Learn more at the Green Party's single payer healthcare system. We actually have thought all about this, and we have a plan. Bernie Sanders talked about it. Its goal is to ensure all Americans lower healthcare costs, reduce administrative waste, promote complementary, integrative, licensed alternative care. I'm a big believer on herbs, as you know, holistic healing. Those prevent. If you talk to you look up Dr. Deepak Chopra, who's an expert, Harvard, medical expert, who telling everybody that the American medical system, the Western system, is based on solving acute illnesses with very strong, dangerous medications, antibiotics, etc., rather than using preventative care over years. If you have an issue like rising blood pressure, anemia, etc., these kind of natural herbs, I believe, can be much better overall in slowing down the rate of preventing over long term these issues. And we have American issues. We have obesity in America. People are eating the wrong foods, fast food foods, We need to think about it on a general level. What if we subsidize gym memberships, for example? $20 a month, that's it. Everybody can get Planet Fitness free. That could prevent major diseases. That's going to save us thousands of dollars per person over the life versus $20 per month. So these are just ideas that we can do. But again, that's more for the medical system to decide to use. And, University of Maryland is very strong in the area of natural and herbal health. They've done some research on that. So what happens when we have this? For those afraid of state-controlled healthcare, we'll have a quasi-independent health agencies that manages the process from fee schedules to services to overseeing performance and following up with patients. So it will be a complete care model. We can even reduce the legal attacks on medical professionals. You see these lawyers advertising all over, especially in PG County, which is really shameful. They essentially are, ambulance chasers looking to make millions of dollars. They make a third of everything that you get, right? A $2 million lawsuit over this accident, over this drug. We hear it all the time. These incidents, and it's basically they're just trying to make a fast buck. We need to get them out of that business and into the real business of helping the state, working for the state, et cetera. These are smart people who are lawyers just trying to make money rather than help the betterment of society. So, let me just pass it back to you to see what you think.
Well, I really don't have much to say about that, but all I'm looking forward to is to see what plans you all have. You mentioned about your party. What plans do you all have to overcome this issue? Working with the state, I mean, making sure that or ensuring that everybody is, getting the healthcare they actually need.
Well, that's the key here. Let's talk about it. Right now, 1.6 million Marylanders are on Medicaid. Medicaid actually covers everything. But a lot of people aren't going to work because they have Medicaid. If they go make more than 138% of the minimum income standards, which is about $16,000, they're not going to get it anymore. And they're a family of four. So the whole system is preventing us from moving forward. We have 1.2 million people on Medicare. So then we have about the whole middle, which is private insurance. Now, employers are paying like twice what you're paying, and so we're paying about $12,000 per person in Maryland per head for healthcare. And these private insurance plans, you go to the doctor, you still have a copay. Sometimes you have to pay this deductible first. Then you get a bill that's some other part is not covered, drugs that are not covered. It's really ridiculous. I mean, we'll talk about the drug companies, pharmaceutical companies. They're taking the doctors out to lunch, fancy lunches, promoting their drug as if they're selling the drug based on a business rather than what the client needs. Our drug prices are out of control.
Okay.
Maryland is supporting the United States is supporting this industry, and the other countries after it becomes generic. For instance, Israel's Teva Pharmaceuticals, the largest generic company in the world. We need to start buying more generics, move over, and rethink the whole patent process, how long these patents last. Because when they have the patent, they can charge whatever they want.
Can I please? Okay, what you just mentioned, I'm glad you mentioned that. But I have another issue. We have like the insurance companies that are out there assisting, especially the elderly, the seniors. I, for one, I'm used to that field. So, as a licensed insurance agent, we've been working so hard to ensure that, like, the seniors that are being taken advantage of, like when they go to the hospital, they don't know exactly what their plans are covered with. So that's where you all need to like work hand in hand with insurance company like the life and health insurance company and so on that are out there. I'm just using myself as an example. We are out there assisting these people to ensure that they know exactly what they are getting with the money they are paying for or what their health plans are covered with. Are you getting what I'm saying? Like, take for example, you have a doctor's visit, right? Like you just mentioned, you go to the hospital, and at the end of the day, they land you with bills that you're not sure about, and so on. That's where we come in. We ensure that we provide them with the necessary plans that are needed to make sure that they know that this is what they are going to be paying exactly after their health is taken care of.
Well, you hit it. You hit it on the nose. That's exactly right. We need to know what we're going to be paying before we go to the doctor. Now, if we take over, if we do a single payer system, the government's going to actually have the power to negotiate. Right now, we don't have the power. The power is in the hands of the medical profession. And you're going to know exactly what each procedure costs, but you're not going to pay for it. Right now, those elderly have Medicare, which is basically we pay all this money every month. Everyone who works pays into the trust fund, and then we use it as you get older. But the trust fund is running out, and then we have the Medicaid. So we do know what the costs are for those programs, and most of it's covered. But then there's also Medicare Part D, and other drugs. You have to pay more for those. But we're spending way too much money, and then on the private insurance. So what we need to do is just revamp it. We can use Canada as a model. What is the United States is considered the 11th best healthcare system, but the most expensive by far. The number one is Denmark, number two Sweden, number three Canada. Let's just look at Canada, our neighbor. We can model ourselves off of Canada. It's working over there. They're spending 7,000 per person. We're spending 12,000. They're spending 35% less. Better care. Where does it start? It starts with the medical profession. Doctors pay 11. It costs $11,000 a year to go to medical school in Canada. We need to have Maryland create a few more medical schools that are subsidized. That starts there because now if doctors have $300,000 in debt before they start, of course they're going to want to make $400,000 a year. But it's not. It's they're making too much as more than the average Maryland citizen. They're making too much money in the medical profession. This has to end. Um, how do we do it? Canada has a universal health care, decentralized, it's universal, it's publicly funded and administered by the provinces, so we can administer it by the states. It's not socialized medicine, it's health care for all. We need to stop. It's all about how it's termed. People are afraid in Kansas and Texas that states are going to take over your health care. They're going to decide what you get, who lives, who dies. It's not that. It's actually the very opposite. These are the same people that have basic insurance. It's not covering basic drugs, basic. They still have a $30 copay. Then they have, go to the hospital and it's a $2,000 bill. Out of the 8,000, they're paying 2,000 or what have you. Yes, in Canada, you can pay more for supplemental insurance. 12% of people do that. Um, so to answer your question, we need to completely revamp the system. Everybody gets health care. We're going to save money. I believe we could save the federal government $3 billion a year and Maryland $7 billion a year. There's our money for our treasury, our precious metals treasury, or uh, lowering taxes, or of course, this is going to cost us. We're going to have to raise the personal income state taxes to pay for insurance, but it's not going to be more at the end of the day because you're already paying for your private insurance, or you, as a Medicaid recipient, you don't have the money. You need to get a new job, and we can find more healthcare jobs as part of this state-run program. We're going to have thousands of medical professionals. Instead of paying the top doctors $900,000 a year, we can spend 400,000 of that on 10 different families who right now go hungry. Let me see what you're saying.
Okay. We are almost heading to the end of the discussion, but before we go, I would really love for you, because I've listened to everything you just said now. What you're actually pointing out, let me ask you this question. Do you think the state of Maryland should provide healthcare to everyone as needed? One more thing again. Do you also think healthcare should be a commodity or should be subject to commodity in a marketplace? Are you getting what I'm saying? Please, thank you.
Wonderful question. Healthcare is a right, it's not a privilege. Whether we decide we may want a constitutional amendment as a state or so, everyone needs coverage. Even if you are a resident and not legal here or a citizen, you could still get covered for emergencies. Um, it's not a commodity. Healthcare is not a commodity. You don't. This is our life and death. This is people's lives right now. People are dying because they don't have insurance. We also have a crisis with our health, the health of our citizens in terms of, it's going to be beneficial for us to promote um, gym memberships and eating healthy. We're literally paying for someone who's eating that big bucket of KFC is going to cost us $10,000 on a heart procedure. So we need to think about we're in this together, no matter whether you like it or not. So why don't we just pay and save money and have people healthier and live longer, and do it from a state-based system that will limit our costs. Obviously, the doctor is going to make a little less, same as insurance CEOs, etc. But from the whole Medicaid and all 1.6, 2 million people in Maryland will now be motivated to work because right now they don't want to work because they got free health insurance. And they're also going to be part of the system. They're going to be managing costs. They're going to be, controlling, not controlling, but doing the paperwork. It's at a lot of jobs. Just like we talked about environmental jobs, we'll have tens of thousands of new medical jobs for people to help in this new system. It's not all about so much more preventative that you don't need a medical degree. To help someone work on their diet, to help someone on their gym members, working out. to help improve their overall health, herbs, etc., it's going to cost us a lot less. And Maryland could start it, and the rest of the country can watch, just like they're watching our all-payer health hospital rate system work. But it doesn't really work because you set the budget for 10 million, a budget for a hospital. What if we have COVID, and then all of a sudden more people need the hospital? So you can't just set a budget for a hospital. Rather, set the budget for the whole state, and this is what it costs per procedure for this year. To get a brain surgery is going to cost $10,000, not $50,000, etc.
Well, what you just said is right, but setting a budget is still subject to change because, like you mentioned, when something is done that costs more than what the state set, like more than the minimum or maximum, whatever the state set for, the state is still subject to make some changes and so on and so forth. Once more again, you mentioned, do you think the universal providing universal healthcare coverage to the citizens will solve this whole issue?
So, like I said, when the state sets the system, it actually becomes law. The state will only pay this much. Now, if doctors want to make twice, three times, they can leave. We have plenty of people from Africa, from India, who would love to come here and provide services for quarter of the cost. Great doctors, well trained. If these folks who went to Harvard Medical School, et cetera, they have their debt, they can't afford to be here, it's okay. They can go somewhere else. In terms of universal, yes, it will solve the problem. We will lower our costs. We will be healthier. We'll save billions and billions of dollars for the state of Maryland. We will also be the model for the nation, which will then move to universal health care because we already are the only state doing all payer system. And it can work, but it's going to take a lot of, sort of, um, confidence that we can do this, and eventually we'll go to the national level and do it on the federal level.
Well, Mr. Moshe, thank you so much. I believe we've come to the end of this discussion. It was really nice discussing the healthcare system in Maryland with you and so on, and hope the universal health coverage is implemented. The law is implemented, and everyone is happy, and you know, getting their health checked and so on from now and onwards. I, for one, I would be so happy as soon as that law is implemented because we all need the health insurance. It hurts so bad when you go to the doctor, and at the end of the day, you are not sure of what your bill will be, and so on and so forth. So, I hope this works.
Yes, and
Thank you so
finally,
much.
and once we do it right, we can then be a model for countries like Cameroon, where you come from, 20 million people. I mean, they're also based on the French, but we have great pharmaceutical companies. We have great medical systems. We just need to implement a universal coverage and do it right. Thank you so much. Have a great week.